Hi, I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope, and someone who's been living with my own chronic pain for over 30 years. Today I want to talk about the importance of helping yourself figure out the difference between your physical pain symptoms and your psychological emotional pain symptoms. When we have pain somewhere in the body, we have receptors, pain receptors. Those receptors pick up a signal that something's wrong, and it sends a signal all the way up our spinal column up to the area of the brain called the thalamus. And from there, there's a signal that's sent to our frontal lobes and we have a thinking response, and from there to the limbic system or the back brain and we have an emotional response. It happens bam, quick, like that. Now, the physical is as real as the psychological emotional. The psychological emotional is as real as the physical. However, the interventions are very important. I call the physical the ascending pain signal and the psychological the descending pain signal. It's really important to know which is which. The psychological emotional or descending signals are what I call the amplifier circuit. This is where the intensity of the perception of pain can go up a couple of points on a 1 to 10 pain scale, depending upon how that signal is processed. Unfortunately, for people living with chronic pain day in, day out for months or years, this constant bombardment of signals to the thalamus takes a toll. And people end up suffering with their pain. Instead of, ooh, this hurts, it's, man, this is killing me, it's horrible, it's awful, it's terrible. That, my friend, is suffering. And I have not suffered with my own pain for almost 30 years now, and I never want to go back to that place. At the first session I meet with people, I have developed an instrument to help them differentiate for themselves the difference between the physical and the psychological emotional symptoms. The medication is meant to alleviate some of the physical symptoms' distress. However, a lot of people get in trouble with their meds when they start using the pain medication, especially the opiates, to deal with the psychological emotional symptoms or for better coping. I want to help people discover that there's more to do than just take medication. That's just 1/3 of an effective pain management plan. They also need to have tools to deal with those psychological emotional symptoms of pain, as well as having non-medication based interventions like exercise, meditation, acupuncture, chiropractic, stretching, massage. There's thousands more that don't require medication. It's having a complete holistic plan in place that will get the best outcomes and the freedom from suffering. And I believe that freedom from suffering is everyone's right, and it's also a responsibility. It's responsibility to get into action and find out what it takes to deal with the whole pain picture and not just to mask the symptoms with medication. Thank you.